So my name is Keven Lefebvre. I'm the fire chief with Leduc County, and I'm on the board of the Canadian Association of Fire Chiefs, and happy to moderate this discussion this afternoon or this morning, depending on where you are in Canada. So provinces, prevention, prayers, and presumption is the title for today. And with us, we have panelists in no particular order. Chief Cam Abrey from Manitoba. We have Michelle Capobianco, President and CEO of Pancreatic Cancer North America. We have Dr. Joel Moody, Chief Prevention Officer and Assistant Deputy Minister for the Ontario Ministry of Labour and Skills Development. And we have Dr. Ken Kuntz from the Medical Oncology Cancer Pharmacology of British Columbia. So with that, with those quick introductions, I do want to maximize our time on the discussions, so I won't go much further into the introductions, but welcome and thank you for joining us today, panelists. So I might start with Dr. Moody and ask you a question first. Joel, what can you tell us about the role of the provinces in firefighter cancer?
Well, first and foremost, thank you very much for the Canadian Association of Fire Chiefs for asking the province to come and chat with you all. Our pleasure to do so. And Chief, to answer your question, the prevention and protection of employees is one of the most important things from a labor perspective that we do. And I think, what we really want to talk about, at least from a provincial standpoint, are that there are two guiding legislations that aid us in that aspect. Because at the provincial level, and I can only talk on Ontario's behalf, but at the provincial level, there are two major legislations that exist. The first and foremost is the Occupational Health and Safety Act. And that's where it creates the shared responsibility from both employer and employee, and what we refer to as that internal responsibility system. Main goal, as always, is to protect the worker from injury, illness, disease, and of course, fatality. The second that is part and parcel to some of the legislative framework is also what we refer to as the Workplace Safety and Insurance Act, or WSIA in the Ontario context. And that is what establishes in Ontario the Workplace Safety and Insurance Board, or the WSIB. And so it's that WSIB, which is the no-fault insurance arm. They are an independent arm of government, but the Ministry of Labour, Immigration, Training and Skills Development, we do enact that legislation. And we do, from the legislative standpoint, make any legislative or regulatory changes that exist. So at the provincial level, that's really where, if there are any potential changes to legislation and regulation, that's where they're made. And I know a lot of work is being done with our colleagues at Health Canada. Current bill did pass to create a national framework. And I know that they're very much engaged with the provinces about how do we work collaboratively in order to truly improve the outcomes, both from a prevention standpoint and in the cases where unfortunately, firefighters do develop a condition. What do we do for the families as well as those firefighters as well?
So a little bit further on that, why is there a variation in the firefighter cancer coverage across the country?
Well, Chief, how much time do you have? I think it's quite interesting. As we know, all jurisdictions do now have what is referred to as presumptive legislation. For firefighters, and it varies. Once again, cancer coverage, but more, quite interesting. I was asking my team to look at the history. It originally started with heart injury, and that's kind of where it started. And then it continued to grow from there. But from the Ontario context, we currently cover 18 cancers that are presumed to be an occupational disease. And that's what kind of occurs due to the nature of the firefighters' employment as a firefighter or fire investigator. We last amended those rules just this past year, where we included a couple of cancers. But to your point, a lot of the challenge that exists with legislation, because it is at the provincial level, has to do with how the WSIBs are funded, because each province sets the rates, they set their own scales. Other jurisdictions, once again, through their presumptive legislation, used many different processes in order to establish what's on those lists. So it's unique. And then even from the federal jurisdiction, the Provincial Occupational Health and Safety Act does not cover federal employees in all cases. And so, there's even opportunities to improve the process and system from that standpoint as well.
Okay, and we'll continue to try and work towards uniformity across the country for presumptive cancer. Michelle, I see a question. I see your hand up. Go ahead.
I just wanted to add from that. I think that it is potentially even simpler. While it's a complex issue, I think it's potentially even simpler in that it really gets down to will. It gets down to will of each province and the federal government as employers of firefighters, what they're willing to do. I would say that when there is a fire, there is no discrimination, and the government and the general public will welcome any single firefighter in to fight that fire. However, should one of those firefighters get cancer, and as we know, if you sign up for being a firefighter, you are going to get cancer, there's 75 to 80% chance. So you go in the fire and you're good enough to fight the fire, but you come out and potentially the government is going to decide which cancer they're going to cover you for and which they're not. They're also going to decide what your access is to medication. And what's not equal across provinces is who can access these medications. For pancreatic cancer, there are medications that aren't even available, that they won't even apply because they can't get through Health Canada's regulations. So it really comes down to will. These are employers, and they have a responsibility to protecting firefighters against any cancer or any risk they have on the job. This deciding them one by one and then deciding which drugs they're going to give and who, I think is abhorrent.
Well, and just like pre-fire planning, we want all this stuff in place ahead of the incident, not fighting the battle after. So thank you. I might move to Dr. Coons. What do you see as some of the challenges for workers' compensation and the same topic that we're talking about?
Well, succinctly, I think we have to recognize that cancer in firefighters is a relatively new concept. The public, people come up to me all the time, how come there's so much cancer? And they marvel. And that goes even double for firefighters. It was only until recently, last year, that the World Health Organization actually confessed, with a panel of 25 scientists in Lyon, that firefighting is carcinogenic to humans. So the first problem is recognizing that firefighting and cancer are synonymous. When I finished medical school, one of the things I tried to do to shock myself back into reality was go skydiving. And when I went to the facility and I was about to get on the plane, the guy said, you have to sign this waiver that you might die. And I said, no, I won't. And he said, yes, you will. Yes, you might. And it's almost like that for firefighting. Just like Michelle said, if you're going to be a firefighter, we have to recognize the fact that there's a high likelihood that they'll get cancer and succumb to that cancer, and we have to protect them and support them and their families if they do. So I think one of the big problems is that cancer in firefighters is a new concept, and our job will be to disseminate information, educate, and provide resources so that we can allow for that in the future.
I don't think cancer in firefighters is new. I think the appreciation and recognition that it's there is.
Well, I wrote an article a couple of years ago about Caesar Augustus, who established the first fire service in 7 AD. He was frustrated. Rome was a city built of wood, and they had up to 100. They had maybe 1 or 2 million citizens. They would have up to 100 fires a day, and he established the first professional fire service and hired 3,700 full-time firefighters in 7 AD. And there was a graveyard nearby, which they excavated recently when they were building a subway from Milan to Rome. And a lot of those skeletons had cancer. So I'm sure that for 2,000 years, firefighters have known that they die of cancer. Matter of fact, you only had to serve 3 years. And if you survived 3 years as a firefighter, you got free grain, olive oil, and a certificate of citizenship. So we're not as caught up as ancient Rome was. We need to do more to support our firefighters.
Good points. I might move over to Chief Abrey. And Chief, what do you see as some of the prevention programs that are in place today?
Thanks, Kevin. I can speak on behalf of Manitoba and what we're trying to do here. So it was a few years ago that a couple of members of Winnipeg Fire implemented their clean gear process that they have. The Manitoba Emergency Services College has also integrated that into the firefighter level 1 program with contamination reduction skills that are being taught and tested, because it is so important to protect ourselves. We know that we're going into these clouds of carcinogens. I'm a second generation firefighter. I'm fortunate enough to have a full-time position, but my dad was a volunteer firefighter in a small community for 19 years. He was diagnosed with prostate cancer. At that time, we didn't have the recognition that it was tied to firefighting. Who knows what it may have been tied to throughout his career. Now we have this awareness that's out there. And myself, I've gone through 9 procedures for melanoma. I've had a few large chunks taken out of me over the past several years. And the first process that I had, or procedure that I had, I had my original turnout coat, and I was burnt by some dripping insulation materials. That rigid styrofoam came down between my air pack and my jacket, burnt a hole right through my jacket, discolored the inner layer, the thermal layer. And at that time, I showed my chief, and it was sent out for repairs, and it's good. Here's your jacket back. But it lines up perfectly where the first mark that I had that I was concerned with, where I went to my family doctor and said, I think there's something here that needs to be checked out. And sure enough, it came back as cancerous, and they did a second process where they had to go wider parameters and a little bit deeper. And there's been 7 other processes since then. So it's one of the things that when I'm traveling in the province and instructing, I make sure that I tell everybody, make sure your gear is clean. If you do have something that happens, make sure that you're filling out some sort of an exposure report. Keep that with the files with the fire department, so that if there is a WCB claim down the road, that if something does happen, you've got something to substantiate your claims.
Well, and referring back to this year's Great Canadian Fire Census, I asked the question about gear cleaners and found the number of fire services out there that still don't have proper extraction washers. So yeah. We're moving the ball forward. There's a long way we can still go.
And that's something that, possibly the provinces could step in and assist with. And that's varied across our country. We don't have any kind of a grant program here in Manitoba that a fire service can apply for. We had a one-time deal about 4 or 5 years ago, and there were a number of departments. So there's 230 approximate fire departments in Manitoba. Of that, there was probably 20 that took advantage of that grant program to buy extractors for their fire department. And they've come up with mutual aid agreements that you go to a large fire, vehicle fire, structure fire, whatever it is, bring your gear in, we'll wash it for you. There are professional companies where you can ship it out as well. The issue is, how are those small departments transporting that contaminated gear to the nearest extractor, like the nearest fire station where they can wash their gear? Are they following the proper procedures that we're trying to instruct them on? Throw on an N95 mask, put on some nitrile gloves, take that gear apart, bag it before, don't ride on your apparatus back with contaminated gear, and please don't carry it in your personal vehicle as well, in order to get it to somewhere where you can have it cleaned.
Well,
so
and
other things we're trying to educate on.
A little bit even more, you're kind of saying we're clean nowadays, we're more about cleanliness. We had old gear, if we got new gear, we would look for the first dirty thing to roll in.
Yeah.
As, but now clean is cool. And,
Yeah.
you know, there's a lot more focus on that. My kids are third generation firefighters, and they don't wear their gear home that they've worn at the station all day. They don't carry their dirty bunker gear in their car at all. There's a lot more awareness and prevention opportunities out there. We have gear rooms in the newer fire stations where they're ventilated separately from the rest of the living area from the fire station. And
The
so
salt
they're,
look is long gone.
yeah, my dad died of a firefighter cancer. My uncle has cancer in weird spots. Yeah, it's definitely there. They were both firefighters as well. So what are some of the, I think I'll move back to Dr. Moody. What do you see as some of the barriers to some of the prevention that we're talking about right now?
Yeah, no, I think, you know, to all the panelists, and I want to say, Michelle, thank you very much for reminding us that, you know, we do have mechanisms, and at the end of the day, employers, supervisors, workers, we all play a role in the responsibility for health and safety in the workplace. And I think, you know, being very clear with those expectations, being very clear with those duties, rights, and responsibilities are so important. And once again, from the Ontario context, we're trying to cut through some of those barriers. And one of those is we have what's referred to as a Section 21 committee. And this is a joint committee both of labor, joint committee of employers and government that sit together. And what they have done is actually they've been able to create a checklist for the local fire services in the province that really are focusing on, you know, the routes of entry, both inhalation, skin absorption, that are, you know, it's not in legislation, but it's a better practice. So really, what can one do? Once again, about wearing respiratory protection, handling of soiled PPE, different types of equipment, leakage of your respirators, and so forth. And definitely to Dr. Kunt's point, the science hasn't always kept pace with reality. As Dr. Kuntz, I'm an oncologist by training as well. And so once again, in my practice, I did breast and ovarian cancer. And we know that once again, the disproportion that affects even from a gender base many times, reproductive health issues and reproductive cancers, we have seen, but the science hasn't helped us. And it's great that you mentioned the work at IARC in Ontario, Dr. Paul Demers, who is the head that led that work at IARC in Lyon, is part of the Ontario Cancer Research Center, or OCRC. Sharing information, raising awareness, first and foremost, but it can't stop there. And that's where it's very important that we have panels like this, where we have representation of various different organizations and different sectors, because we all have a duty, my words, to continue to raise that awareness and identify where the gaps are. Because if we aren't able to identify the gaps, how can we then close them? And Michelle, you raised a great point about, just, once again, if someone were to develop a disease, access to the best medications or access to medications is still a challenge in some places. And let's not even forget about the difference between the provinces from a geography standpoint. And we could go on, once again, Chief, to talk about wildland fires, which are, once again, different than our colleagues that do structural fires. So it's through these types of discussions that we're able to identify, do the assessment, and then we have great people that can put the heads together to plot a path forward. So that's where I would say that we can definitely improve and make progress.
So staying with you, Dr. Moody, there's a question in the chat, which I'll put towards you, and you can probably see it as well. But is there a possibility to implement federal presumptive illness legislation to capture gaps in coverage between agencies?
That's a great question. And once again, thanks for the member who provided it. It would be potentially challenging. And I think this is one of the aspects of how the Canadian structure is set between federal as well as provincial jurisdiction. Federal jurisdiction can provide frameworks, but until provinces agree, until all provinces identify what can be done, it may be a challenge, but it's not impossible. And I think that's where let's have the conversation, let's identify. Once again, I know, once again, only from Ontario, we're continuing to add new diseases, new cancers to that presumption list. Currently, we have a couple of legislations that could be adding esophageal cancers, for example, and also potentially modifying the latency period presumption, from 25 down to about 15 or 10 years. Those are steps. And once again, but it takes the ability for all of us to raise it with your local provincial governments so that we can have those conversations.
All right, thank you. I was going to say that, well, I'm sure it'll get back to me. I was thinking of something else. So, Michelle, what do you see as some of the costs associated with this whole firefighter cancer approach to prevention?
Thank you very much. And thank you, Dr. Moody, for talking about all of the ways that the different provinces need to work together. And I would just add to that, that while the responsibility and onus is certainly on firefighters, their unions, advocates like us to advocate the government for better, each government in each province for better care, there's also a huge responsibility of the employer and making a decision on the value of a firefighter's life. So I can tell you that if I run out of my house today and I'm hit by a bus, there will be no limit to the amount that will be spent in the hospital to save me, whether I need brain surgery or whatever I need. Depending on what type of cancer you get and in what province, the governments, the employers are making a decision on who they're going to save. And they make that decision by what they choose to cover and what drug access they have. So the cost, to get to your actual question, is unbelievably high. There's the cost in medicine, with the average firefighter having to pay 30% out of pocket for cancer care expenses, which only goes higher if the particular cancer isn't covered. There's the issue of widows and widowers not being, the pension not being properly allocated if the government hasn't recognized it. So I think it's the real core of this is the value we place on firefighters and the value we insist that employers place on firefighters' lives and how they're going to be treated. Screening needs to be changed and made mandatory from age 40. Physicians need to know what they're looking for in firefighters. Have to step up and do better, regardless of the cost. COVID showed us there was no limit to the cost we would spend as we turn to pharmaceuticals to solve the problem. And yet there's a cost placed on every firefighter's life, and that's wrong.
Well, and as we talk and we're each day or each year, we're more accepting the fact that cancer is in firefighting and one of the most carcinogenic professions you can be in. That has an impact to recruitment and retention. And so our firefighters need to see that we are putting prevention and parameters in place to help reduce the risk. I mean, with any job comes risk. I'm an electrician by trade years ago, and electrical shock was a risk. I still did it. So, I love the profession, as probably Cam does. We know the risk, but certainly, we're also passionate about reducing the risk. Dr. Kuntz, what is on your prevention wish list going forward? What are some of the low-hanging fruit or some of the long-term opportunities that you would like to see?
Well, first of all, thank you. First of all, as I'm sure Dr. Moody will concur, cancer is a natural consequence of living. We know that even from the fossil records that dinosaurs routinely died of cancer. When I give a lecture on cancer in firefighters, I showed the skeleton of this Tyrannosaurus Rex that died of metastatic bone cancer, just like Terry Fox. So cancer is an ineluctable and natural consequence of existence. Everybody's going to get it. Firefighters are more assuredly scheduled to get it. And, society should recognize, we should say to somebody, if you want to be a firefighter, there's a high likelihood you'll acquire cancer and possibly succumb to it and we will protect you if you do, and we'll support your family. That should be like right at the very top. And I agree with everything that Michelle said. Probably I don't need to talk anymore after she did. But if you're talking about prevention, you know, cancer prevention, that screening and surveillance is one part of it. Screening and surveillance is murky. You know, there are no established guidelines in any jurisdictions. This is why recently I wrote a letter to physicians recommending that firefighters should be screened as special individuals in a category as if they had familial cancer syndromes or had a genetic mutation, you know, that conferred a risk of cancer. So screening and surveillance, like as Michelle pointed out, should begin in firefighters 10 years earlier than the general public. We know that firefighters are subject to getting any type of cancer, not just the cancers that are designated by Workmen's Compensation Board. Furthermore, as an oncologist, I've never known any cancer to obey a minimum cumulative period. You can get a leukemia in 3 or 4 years after being exposed to polycyclic aromatic hydrocarbons, or that cancer can wait for 45 years if you've been exposed to asbestos. So we need to develop international, that's a better word, international cancer screening and surveillance guidelines, especially for firefighters. And then the other thing is, since we're all scheduled to get cancer at some point, and the maximum span of a human lifespan is about 126 years, gerontologists have calculated, we will all eventually get cancer. It comes down to the other most important fact, which is personal accountability. You know, a firefighter should minimize their exposure to carcinogens in the field, but that's impossible. We know that in the heat and pressure of a fire, hundreds of thousands of different toxic chemical compounds and heavy metals are aerosolized. These molecules are less than a billionth of a meter in diameter. They pass right through the bunker gear onto the skin. And when I was a graduate student, I coined this phrase, on you is in you, because I was working with very toxic alkylating agents dissolved in solvents. And I recognized that every time I splashed it on my skin, I was getting it IV. So firefighters cannot prevent the fact that they're getting slathered in potentially thousands of different carcinogens on their skin. And these are absorbed right into the bloodstream and pumped around to every organ system in the body. You know, there are 220 different cell types, you know, like liver, thyroid, brain tissue. All of these different tissues, you know, they have maybe 50 or 100,000 protein coding genes. Any cell in the human body is liable to be, you know, transfected with these carcinogens, and a firefighter can get any type of cancer. So it comes down to personal accountability. That includes diet, you know, sugar. You know, our diets are, you know, absolutely abysmal. If you go into any supermarket, everything is processed, you know, with preservatives, high sugar, high fructose, low fiber, preserved foods. We don't have to do any work to get our food. We can drive to the supermarket or the liquor store and buy our cigarettes and tobacco. And then the other thing is, you know, if somebody asked me as an oncologist, what do you think the most important preventative for cancer? I would have to say activity, because inactivity is one of the most ruinous human endeavors. You know, all the cells of our body turn over regularly. Every tissue has stem cells, and the driving force for repairing and regenerating tissue is movement. We see this in patients with bone marrow suppression after chemotherapy. If they have neutropenia, if we make them exercise, their neutrophils bounce back much faster. So a lot of it is personal accountability, you know, high-risk behaviors like smoking, drinking, unprotected sex, the use of illicit drugs, you know, maintaining an appropriate weight. Yeah, so there are, you know, the good news, you know, the bad news is if you're a firefighter, you can get cancer and die of it. The good news is that most of those are modifiable risk factors if you're personally accountable and you have this long-term play situational awareness. I'm a firefighter. I might get cancer. What are some of the things I can do now to modify or ameliorate the risk?
Thank you. I'll put the same question to you, Dr. Moody. What's on your prevention wish list?
I couldn't say it better. You know, at the end of the day, you know, we always talk about the moniker, prevention better than the cure. And that's true. Definitely the concept of risk is something that I and my team talk about quite frequently, and that we're trying to find ways to minimize risk. And so within the occupational health and safety literature, is it about, looking to use different types of processes? So engineer controls. I know we've talked about, substances, PFAS is one of those that's gaining a lot of traction. Are there substitutes to that particular chemical, for example? Are there other types of mechanisms that can use to better equip through the bunker gear? That once again, finding ways to minimize exposure and therefore try to find ways to minimize risk. Once again, I don't say eliminate risk, because once again, it's one of those things that we're trying to manage and not increase risk unnecessarily in certain situations. And even I think at the last session that we had in Ottawa with the group, questions about, what are the mechanisms by which firefighting is actually done? What are the suppression efforts? Historically, we, once again, speaking not as a firefighter, but, we see firefighters go in to try to save buildings. Is it always necessary in order to, once again, minimize exposures from what's in those the burn? We know that furniture, a lot of different compounds are now being developed. What are the off gases when they're being burned, and what is the issues that happen in those types of aspects? So going back to, from a prevention standpoint, it's very important, and that's my responsibility within the Ontario context from an occupational standpoint. How do we bring together all of the different mechanisms that we talk about around managing the control to those exposures? So that's one place. But once again, I keep going back, that internal responsibility system is so key. Joint responsibility between employer and employee to find those opportunities.
All right. Chief Abrey, I see your hand up.
Yes, thanks. I just wanted to make a couple of comments there on what Dr. Coons and Dr. Moody were just saying. First and foremost, thank you for the letter to the medical professionals. I have had past members of my fire department diagnosed with cancer, and I try to walk them through the WCB process here in Manitoba. The family practitioners are wondering, why do you want to be screened for this? And there's always the questions. So then, who's your family doctor? Can I talk to them? We need it. And we brought this to our provincial association, that we need a letter to hand to through the medical society that goes and educates our professionals about the elevated risk of firefighters and cancer diagnosis, and the benefit of early screening. You also mentioned what's on you is in you. And that's something we as a fire service have to do better. At long duration calls, when we're bringing in rehab, the food and the drink, firefighters are going in there in their contaminated gear. They're not washing properly. They're not cleaning, and they grab a sandwich, and it's not only absorption now, but they're ingesting all those carcinogens off of their hands and, dirty sandwiches and whatever else that they're getting into them. There's some terms that both of you used that we talk about in the fire service all the time. Situational awareness. There's a whole program by Dr. Richard Gasaway that talks about why are we killing firefighters, but it's not about the cancer. It's about being aware of everything that's happening around you. So we have to look at those short-term things that we're talking about and educating our firefighters on situational awareness, and the long-term of the carcinogens, of the elevated risks of cancer. And I had another note here that I wrote down, Dr. Moody talking about manage risk. Risk management is a #1 thing in the fire service, right? What level of risk are we willing to take when we go to a fire? But what about the long term? What is that risk level that we're looking at when it comes to the cancers as well? So, both of them, they're terms we use on a fire ground all the time, but I think as a fire service, we really have to educate ourselves on the short-term and the long-term effects.
Cam, that was wonderful. Listen, I just have a quick comment. I just wrote a brand new 2023 firefighter cancer letter for physicians, in which I was able to squeeze in, with good writing prosody, everything that I've learned about cancer in firefighters over the last 33 years. And this letter is essentially a psychological operation to win the compassion of a primary care physician in the field who's looking after firefighters. And I specifically stated firefighters should begin cancer screening at age 40 as if they are in a special risk category, like someone with a familial cancer syndrome. And these are the tests that I would like to see done: 1, 2, 3, 4, 5. So I think I sent Tina a copy of this letter, but I'll be publishing it soon. And I hope that all fire departments can get a copy of it, because I wrote it specifically to appeal to primary care providers.
And thank you for that, Dr. Kuntz. And I see it's popping up in the chat. Everybody's asking for a copy of that letter. So, something that we could give to our medical professionals in every community and distribute through our provincial associations, and however we could do it.
Can I just add something to that? So and I see Gord Ditchburn is in the audience. We're working with the Firefighter Cancer Support Network. And so Dr. Kuntz has shared that letter with me. We've also produced a letter which is available in every province, which goes to your GP, which outlines all the cancers that firefighters are at risk for, what the signs and symptoms are, and what it's often misdiagnosed as. So if you get in touch with your local Firefighter Cancer Support Network contact, they can also give you that letter along with Dr. Kuntz's.
And that's something else that might be the low-hanging fruit that Keven had asked about, is the Firefighter Cancer Support Network. Because honestly, a lot of people think that that's only based in south of the border, that they don't realize it's here in Canada. So there's another question that just popped up there of how do we find who our local is in each of the provinces and jurisdictions?
Yeah, and I'll let you know that we have Pancreatic Cancer North America has signed an agreement with the Firefighter Cancer Support Network to represent them across North America to help with fundraising and access as well. So we're going to give a list of your contacts in each province. We'll make that available afterwards through Tina.
That's great. Thank you.
It's interesting. Dr. Kuntz talked about latency periods and how not all cancers are going to react the same way for every person. And it reminded me that when my dad got cancer and died, he was 3 months short of the latency period required for the lymphoma he had. And so mom was left with nothing. He was 62. So
and Keven, this is very good for the taxpayer, because if you deny benefits to a firefighter who has cancer, you will save money. And this is what I found. I go up against, single-handedly in 4 or 5 cases now, I've gone up against the Workmen's Compensation Board for just those kind of hijinks. Like recent, a few years ago, a firefighter died in British Columbia who had 19 years of service and died of esophageal cancer, and the cutoff was 20 years. Yeah. So, I would say this about workmen's compensation: if you would deny a firefighter benefits for dying in the line of duty, and you're successful in denying the benefits, I can just say this: successful behavior repeats itself. So but as a civilized society, we have to recognize that firefighters get cancer and die of cancer, and we have to be prepared if we want firefighters to help us. And I hear them every 10 or 15 minutes because I live downtown. We ought to be prepared to protect them. And that means paying.
Yeah, there's a cost to all of this, that's for sure. Michelle, I'll give you a last opportunity on the wish list. Just, is there anything that you have to add on that prevention wish list?
The prevention wish list for me is that each and every GP in each province understands the risk that firefighters are at, that they encourage firefighters for individual cancer screening at a much earlier age. I agree with Dr. Kuntz, 40 is an age when they should be screening. GPs need to understand all the cancers that firefighters are at risk for, and we need to continue to pressure each provincial government for the firefighters to be paid properly, protected properly, and have equal access to medication.
Thank you. And Cam, I don't know if you have anything to add for wish list.
Well, the wish list is just the biggest one that I have is that people would listen. I get up on my soapbox as the president of the Provincial Association here in Manitoba, as a casual instructor of the Emergency Services College here in Manitoba. My own personal experience I tell people the importance of doing this, and I just hope that the word gets out there, that people do listen, that they do start to protect themselves, right? That there is proper washing procedures. Don't throw that dirty, contaminated gear into your vehicle. And it's just, we can talk about it as much as we can and want, but is a message being received by our brother and sister firefighters? That's my wish, is that we can eliminate the risk as much as possible.
Well, and in my opinion, I think that, we continue to do hard work. We're not stopping knocking on the door, but I think that with the recent appreciation that firefighters do get cancer, more types, more often, sooner or younger, however you look at it. We didn't even talk about, Dr. Moody, I think, introduced really quickly the gender-based cancers. And as more women are entering the firefighting workforce, female cancers are underrepresented in the presumptive area. So we've got some work to do there. So yes, we're not going to stop getting our message, but I think people are starting to listen. And when we can hear that cancer has been admitted as one of the firefighting is one of the highest carcinogen risks in the profession, people, how could they not start listening? We're down to our last 20 minutes here, and so I might ask a question of, don't want to lose my place here. What are some of the opportunities and challenges to moving this forward? I think I asked it previously, but what's our path to success look like in your eyes, Dr. Moody? I'll start with you.
Yeah, thanks again. These are great questions, because this is the reality that we face every day. One of the challenges, and I'll just speak from a regulatory or a governance standpoint, is we want to use science to help us with decisions. And so that is one of the questions that we're always asked is, what is the science that helps the elected officials make those determinations? And sometimes, as we said, the science lags, but yet we need, how do we provide the evidence that informs those decisions? So that's the reality that we face at certain days. So are there opportunities to connect for people that are doing the research that can inform? Are there opportunities to connect with our healthcare system to inform other government or ministries' legislations? Because I think for many times we think of health in silos, and especially from an occupational health standpoint, health is part of what we do. And so I know in Ontario, we've have very strong connections with our Ministry of Health. COVID, to your point, Michelle, COVID changed the paradigm about how we think about public health, occupational health. So being very strongly connected between ourselves in order to find ways to move things forward. But the information that we have in order to support the policy decisions, those are the challenges that we have.
Okay, thank you. Just in preparation for this yesterday, I did have a quick phone call with Michelle from the Pancreatic approach of things, and just before our conversation that we were trying to line up, I got word that another coworker of mine has just been diagnosed with pancreatic cancer, who I'll be referring to Michelle. But a question in the chat, interesting, kind of related to the latency period, but I think there's maybe some confusion as to process of how, I go to my doctor, I get diagnosed, is the process clear and in place of, is there clear direction given for firefighters or fire services of how to approach health and safety in this regard? Encouraging firefighter annual or biannual physicals, encouraging certain tests 10 years earlier than the general population gets it. Having follow-up. Don't ignore if the doctor says, well, maybe you should pay some attention to this spot here, don't ignore it. Lots of things we can do. Michelle, I'll put the same question back to you. What do you see are next steps?
One of the things that's equally important, along with prevention, and we've spent a lot of time talking about prevention, is how we deal with firefighters once they have cancer. Canada is the last in the G8 countries as far as the time it takes the longest time to get a drug from approval actually to patients. 2 years is the average rate. With a disease like pancreatic, where you're often dead in 4 weeks from the time of diagnosis, you just don't have time. And so the next steps are that we need to deal with our provincial governments, deal with employers of firefighters, and insist that they get treated properly, that they get proper access, that they get recognized as having an extremely high risk job, that they have access to the right medication, and they have the access to the right treatment. There has been decades of studies on if firefighters are getting cancer from being firefighters. With all due respect, enough with the research. We have presented paper after paper after paper, and yet I'm still dealing with a widow in Ottawa whose WSIB said to her, which fire did your late husband get pancreatic cancer in? Ludicrous, an absolutely ludicrous situation for employers. And so while I love the idea that we're going to put the onus and responsibility on firefighters and all the things they have to do, they have the right to demand significantly more from their employers as far as access to medication and good health care, and they should not have to prove it anymore. It is a fact, and it has been a fact for decades, that if you sign up to be a firefighter, you are going to get cancer.
True that. I might take the last 10 minutes of our time today just to give a bit of a roundtable, so 2 minutes at a time. Cam, any closing comments?
Yeah, no, I really appreciate what Michelle just had to say, because in dealing with WCB claims here in Manitoba, that's exactly what it was which one of the fires did they attend that gave them the cancer? And it's, are you serious? There is a question that's in the Q&A about if a firefighter moves between provinces, which is very interesting. So we know that we have brothers and sisters in the fire service that have gone from Ontario to Saskatchewan, Alberta, wherever, over their entire career. And I honestly don't know how, if you ended up in British Columbia and you were diagnosed with cancer, but you only spent 3 years on a BC fire department, but you spent 20 in Saskatchewan, 2 in Manitoba, now you're over that threshold where you'd be eligible. Would they cover that? And I think that's a great
It's
question.
actually even worse than that, because if you're in one province, you might get access to a medication for that cancer. And then if you move to a different province, you will no longer be treated for that cancer.
Wow.
Or even in the same province. I recently worked on a case successfully where a young firefighter who had cancer here in British Columbia was a wildlands firefighter for 12 years and then a structural firefighter in the city for 7. And because he had 7 years in the fire service, his cancer was not recognized. And I had to write all kinds of papers and go back and forth to prove that the 12 years and the 7 years were cumulative, that they were additive. Finally, in the end, workman's compensation had to give way to reason. And the case was won.
Yeah, and there's kind of a related question in the chat again about wildland firefighters typically are seasonal. So, how do you calculate the years of exposure?
But their exposures are intense, because if you look at any of these wildfires, wildlands firefighters are sent to the scene of the fire. They're there for 2 or 3 weeks. For 2 or 3 weeks, they live and eat and sleep in tents in this smoky haze. And they get these massive industrial doses. And, if you think wildland firefighters are not as toxic, consider a cigarette. That's grass and leaves. The burning cone of a cigarette is 1,000 degrees centigrade. when you crack or, pyrolysis, when you burn natural products like vines and leaves, a study was showing that in the combustion effluent of a cigarette, there's over 5,000 synthetic compounds, including toxic heavy metals like polonium, which undergo beta decay in the lung cells. You're essentially radiating yourself from the inside out. So wildlands firefighting is a potent carcinogen and must be recognized as so.
If I could, Kevin, just a quick closing was, I really appreciate what everybody's doing towards this. And just thinking back that when the presumptive legislation was brought in place here in Manitoba those years ago, it was only for the career fire departments, which out of 230 fire departments, we have 2 that are completely career and 2 that are composite. All the rest are volunteer fire departments, and either Northern Affairs or First Nations fire departments, along with the municipal and industrial. So now all firefighters are covered, and including the Office of the Fire Commissioner staff, so their fire investigators and their instructors as well. And effective January 1st, wildland firefighters in Manitoba are being recognized in that presumptive legislation. So we've come forward here in Manitoba, which is great. The most recent were the 5 additional cancers that were announced last year and incorporated into the 19 that we now have in Manitoba. And seeing some of the questions in the Q&A and in the comments, and Blaine, your comments about First Nations firefighters not being covered because of the federal, it's understood, but hopefully we've made these changes over the past number of years, that through the continued conversations and discussions and the battles like Dr. Coons is talking about, that we can have everybody covered. And that's the big wish, is that fire doesn't discriminate. It's affecting us all. And hopefully, Bill C-224, the national framework is something that's going to assist in that as well, and protecting us one and all.
Yes, I mean, it does seem to me like the next steps, as Michelle rightfully says, that the science is in place. We've been saying this for years. We need all of the different compensation groups across all the provinces and territories to get on the same page. Maybe from some federal leadership could be assistive in that way, but make sure that no matter where we're fighting fire in this great country of ours, whether you're First Nations or whether you're in the smallest community or the largest community, whether you're volunteer or full-time, you've got that coverage so that you can go and do your job serving the citizens of Canada. And when you get sick, they're going to look after you. All right, Dr. Moody, 2 minutes, closing remark.
Once again, thank you very much for allowing me to come and listen first and foremost, and as well as to provide at least the Ontario perspective. At the end of the day, to everyone's point, it's imperative that we want to do better, and it's also imperative that we should do better. And so definitely that's why from my lens, that's why I'm here, because that is my responsibility for the province. And I do take my responsibility very seriously. And so definitely I will have my conversations with my minister to see what more can be done on all aspects. So definitely to many points, prevention within the Ministry of Labor, Immigration, Training, Skills Development. Farming care is not within our portfolio, but how do we talk to that particular those groups where that oversight is there? Once again, bringing all the groups together and parties to really understand and tackle what we do. And that's why we rely upon our Section 21 committee. We've been very clear that this is a priority for Ontario, and our Section 21 committee is at the forefront of many of the things we do. And as I said, the report that came from IARC, that was led by research that was done here in Ontario through Paul Demers and his team. So once again, very much it's on our minds, and we want to continue to see action happen. So please let us know what more can we do, and we'll definitely be listening to find action. Thank you.
I'm sure this is not the last time we'll talk. Dr. Coons, last closing comment.
So one thing that I want to make sure that we don't miss, and this is, of the phenomenon that we refer to in medicine, and and Joel will understand this, is translation. You know, translating research into action in the clinic. You can develop a new cancer drug, which has miraculous response rates in melanoma, but if you don't use it, you won't see those response rates. Well, you know, society has recognized, you know, the World Health Organization through the IARC, that firefighting is carcinogenic to humans. So that's a revelation, but what has been done? Nothing. There are no recommended cancer screening guidelines, no recommendations. This is a situation where, as Michelle pointed out, you know, we have years and years of research, but what has it translated to? Nothing. You know, I think Lexi Bowman is in the crowd. Lexi Bowman is a young medical student at Queen's University. Her father, Craig Bowman, died at age 47 of advanced metastatic drug refractory esophageal cancer. He had 20 years of service with the Welland Fire Department, and he was heartbreakingly denied benefits. And Lexi and her family fought tirelessly with politicians and other organizations to successfully lower the minimum cumulative period from 25 years to 15. That will help hundreds of firefighters. You know, that's translation. So what we need to do is, you know, translate what we know into practice in the field. That's my comment.
Thank you. And like I said, if we don't support our firefighters properly, pretty soon we won't have any. We need to make sure that all supports that they need, not unlike the tools they need to fight the fire, if they need support after the fire, we need to make sure that all of that's in place to make sure that we can keep our firefighting forces in whatever their employment is, keep them in good numbers so that we can keep the Canadian citizens safe. At 27 minutes after the hour, I just want to take this opportunity to thank our three panelists, Dr. Moody, Dr. Kuntz, and Michelle, and I won't say your last name because I don't want to get it wrong, sorry. Your insight today is invaluable. The questions I thought were thought-provoking, and you know, some good comments in the chat room today as well. I think we've tried to answer as many of those as we could. And I see our President, Chief McMullen, is here as well, saying thank you for your time today. And hopefully this isn't the last conversation that we have. So thank you.